Ayurvedic Dosha Analysis. Reason for writing this article is to analyze which dosha disorder is more prevalent and which is less prevalent. Since there is a lack of reference and it's entirely analysis work, I was not successful in publishing it as a thesis, so decided to post in my blog. This data will help us to balance and focus on that particular dosha more to prevent many diseases and also to find a permanent cure for the diseases for which we don't have a treatment. I did this analysis by collecting a sample of 10 patients' medical reports. I didn't get the chance to examine them personally. All the points that I'm going to give in this article are based on my analysis of the sample records and pulse reading of a few people, apart from the 10 patients. If this idea gets executed practically, it will pave the way for disease-free life, since it will be easy to identify what kind of disorders a person might get and which type of people, dosha constitution type, may get affected by particular dosha, and suggestion of diet and lifestyle can be given based on it. As per Ayurveda, human body is made up of mainly 3 components, in Ayurvedic terms, called dosha or tridosha. In every person, 1 or 2 doshas will be dominant. If a person follows the diet, daily routine, and seasonal regimen according to his constitution, he can live a disease-free life. For that, one must know his prakriti, dominant dosha from birth. Even though the dominant dosha is 1 or 2, tridosha are present in the whole body. People with vata constitution are more likely to be affected by vata-related disorders than pitta and kapha disorders. Likewise, pitta constitution people are affected by pitta-related disorder and kapha constitution people by kapha-related disorder. I wanted to do more analysis on this. A question popped up in my mind: which type of disorder is more nowadays? In medical terminologies, we know hypertension, diabetes are common nowadays. What are hypertension and diabetes in Ayurvedic view? And also, I have done an analysis on which gender is prone to diseases more. While finding a medicine or treatment, it is important to consider the individual person's dosha type, environmental factor, nature of the disease they are affected with, mental status of the patient, property of the medicine we are going to prescribe. Like how we have different creams for different skin types, medicine also differs for each individual even though the condition is the same. The above table is derived from 10 patient reports from one particular hospital. I took samples of 10 patients, mostly aged 55 years and above, since in this hospital, the patient range is mostly above 50, rarely young-aged people come. This study was mainly conducted to know which kind of dosha imbalance is occurring in people so that we can prevent it before, based on individuals' doshic constitution, environmental factors, property of the medicines that are prescribed for any disease. I was not personally able to check the pulse of these patients, but when I checked the pulse of normal people, I noticed that many people had vata, pitta or vata pitta as their prakriti. Very rarely I found Kapha-dominant person. I will explain the observation now table-wise. Table 1 shows the overall consolidation of the patient age, gender, condition and its dosha type. Keeping this data as a base, the remaining tables were formed. Table 2. Based on the Table 2 observation, it is evident that the Vata imbalance is more. Next is Kapha and Pitta is the last. Since the reports belong to patients aged above 55, it is observed that generally Vata will be dominant in old age and they are more prone to get Vata disorders if proper regimens and lifestyle is not followed. Table 3, Hypertension, Vata, Hyperlipidemia, Vata, COPD, Kapha, Atrial fibrillation, Vata, CAD, Vata Kapha. Conditions are mostly occurring in this age range. It's natural to have Vata disorder in old age, but what about Kapha? The reason is, as we age, Kapha dosha decreases, which affects old age by providing less support and protection to the body and mind. Table 4. Females are more affected than males because of their unique physiological and psychological constitution, and females have to undergo various hormonal transitions throughout their lives, such as pregnancy, childbirth, and menopause. These can also cause stress, fatigue, and emotional disturbances, which can weaken their immune system and make them more vulnerable to infections and chronic diseases. Table 5 and 6. Based on this observation, females are mostly affected by Kapha disorder. Generally, it is believed that females are Kapha dominant despite whatever is their prakruti, but it is not proved. Males are affected by Vata disorder. When we see condition-wise table, females are affected with both Vata and Kapha doshas and males by Kapha, Vata and Vata Kapha. Based on the above experiment, it has been found that age factor plays a major role in particular dosha imbalance or disorder, and Vata dosha is more dominant than the others, and dosha imbalance varies with gender also. Many researches are done on reversal of aging, i.e. regenerative medicine, in Ayurvedic terms, Rasayana treatment. Even though disease occurs at any age, it is believed that if aging is prevented, most diseases won't occur. The aim of this study is to prevent disease before it occurs by knowing the predominant dosha causing disease and what all the factors that are involved in the disease process, so that proper regimen can be followed to prevent it. Based on this study, it is concluded that Vata dosha disorder is more in the people above age 50 years and measures should be taken to prevent it. Not only the age factor, but a person's constitution and the environmental factor, property, and nature of the treatment or medicine also should be considered to cure a disease.